Hello, I'd like to speak with you today on the subject of abortion. Abortion has been a highly controversial subject for many years, but I believe the facts support the option to abort and every woman should have the right to make her own decision. As mentioned in the article, some abortion debate facts on articlesalley.com, being in favor of abortion is considered being pro-choice. Pro-choice has different levels of supporters, including those who would not have an abortion themselves but believe a woman has a right to choose if she will give birth. Also, some pro-choice advocates believe a woman should be able to have an abortion at any time prior to birth, while others believe women should not abort past the earlier stages of gestation. Some of the arguments that support abortions are that a fetus is not viable or able to survive outside the womb in the early stages of gestation, that the lack of legal options result in illegal abortions, and also the consideration of extenuating circumstances. Perhaps the most controversial topic is the argument regarding abortion is the viability of the fetus, or the ability of the fetus to live outside the womb. I believe the age of viability is an important aspect to determining if it is acceptable to perform an abortion. According to Jennifer Russo, who wrote an article on Yahoo Voices, the age of viability of the fetus is the point at which a fetus reaches the capacity to survive independently of the mother outside the womb. There is no specific formula for determining a specific age of viability. In fact, healthcare professionals have multiple opinions on the age of viability, which ranges anywhere from 21 to 28 weeks. The median age of viability is 24 to 25 weeks gestation. At this point, the fetus has a 50 to 70% chance of survival. Most newborns that are born significantly premature will require intensive medical care and maternal care. Without this type of care, the chances of survival are minimal. Most premature newborns usually have underdeveloped internal organs, which can result in health complications and require weeks of intensive care. And while the age of viability of the fetus is a major aspect of the abortion debate, there are also extenuating circumstances that must be considered. It is irresponsible for society to make a blanket statement that all abortions should be illegal. There are always cases of extenuating circumstances that must be considered. According to Women's Issues on About.com, women, or in some cases young girls, who are victims of rape or incest, should not be forced to carry the fetus and give birth, as this would cause even more psychological harm to someone who has already been victimized. The website WebMD describes additional reasons for abortion, such as terminating the birth of a fetus with severe medical problems or birth defects. It would be cruel to force a woman to give birth to a fetus that has no chance of surviving. And additionally, abortion should be considered when the health of the mother is at risk. Another important aspect of abortions is legality, without which we would return to the dark days of illegal abortions. I believe that women will find a way to have an abortion, regardless of whether it is legal or illegal. In 1973, the well-known Roe v. Waid decision resulted in the Supreme Court legalizing abortion. Prior to the legalization of abortion in the U.S. in 1973, abortion had been illegal since the 1900s. And during this time, many women died as a result of poorly performed abortion procedures or from complications that resulted from unsterile conditions or infections. According to the website eMedicine Health, the problem with illegal abortions is that they are not regulated by the U.S. government. And that means anyone can perform an abortion, even if they do not have a medical degree. Also, according to this website, 13% of all deaths of women worldwide are from complications resulting from illegal abortions. And those are current numbers as of today. That equates to more than 1 out of every 10 women. It seems painfully clear to me that the guaranteed increase in illegal abortion-related deaths is not acceptable just because we don't think it should be legal. While abortion will continue to be a hot topic, it is abundantly clear that it is critical to the civil rights of women to have the ability to control her own body. Women should have the right to terminate a pregnancy before the fetus has reached the age of viability. Women should have the right to terminate pregnancies resulting from rape or incest that have deformed or diseased fetuses and that are putting the women's own health at risk. The website eMedicine Health reports that there are 30 to 50 million abortions, both legal and illegal, worldwide every year. So who will take care of these unwanted children? We can't even ensure the care and safety of the children we already have. Thank you.